Tools that you can use to treat more patients. Let's see what tools you can use to treat more patients. First of all, you can train more doctors and nurses. This can be achieved either by enrolling more students or training them faster. As you probably know, especially when it comes to doctors, the educational process is very lengthy and it can take 10 to 15 years. With more manpower, you can treat more patients, even if you don't change the processes or technology used. The second thing you can do is to attract doctors or nurses from other markets. This will not solve the global problem but can help a specific, usually a rich country, improve slightly the situation. The next thing I would recommend using is to automate processes by using AI and robots or adding more machines. This will help shorten the time per one patient. In this way, doctors and nurses can take care of more patients. In some cases, the software and machines can take over the task altogether. On a similar note, you can use changes in technology to make the treatment easier to apply and faster. Again, this will help the doctors take care of more patients. The fourth thing you can try to do is to relax the legal requirements for doctors. We have in mind not only letting more people become doctors but also changes in the law that will lower also the demand for their services. For example, if a drug does not require a prescription, then you don't have to visit the doctor to get this specific drug. A similar move that will help with the lack of well-trained staff is to add more paramedics to the system and shift a bigger chunk of the work to them. Paramedics require fewer years of education and usually cost less. Obviously, if we manage to treat faster the patients, then in most cases, we will be also able to treat more patients. This is especially true when it comes to removing bottlenecks and optimizing processes. Bear in mind that optimizing a process to treat more patients may suggest a different course of action than optimizing a process to treat patients faster. We can also add more tools, assets, and software to treat more patients. Quite often a tool or a software product can replace a doctor and help increase the capacity of the system. Finally, we should also prevent doctors and nurses from leaving the system. People can leave the system by moving to another job outside healthcare, retiring, or even immigrating to another country. To minimize this problem, you have to take care of salaries and working conditions. You can achieve some progress also by raising the retirement age. In some countries, after you graduate from medical university, you have to work for state hospitals for a certain number of years. This sort of regulation is done to stop people from migrating in big numbers right after graduation. That's in short. As you can see, you can work both on the supply and demand side. Making the treatment faster can also help with the goal of treating more patients as well.